Hi, Professor Dobratz. My name is Lisa, and I'm going to be presenting to you today on disaster intervention. So a brief summary of this is that I will review treatment plans for individuals in crisis, characteristics of an effective mental health professional, effects that these health professionals should take to de-escalate, and how I can use this information to prepare for my future career as a mental health professional. So first, what is psychological first aid? So basically, it's a treatment method for those who are going through trauma and crisis. So the definition of a trauma or crisis is an event where a person has lost the ability to cope. So basically, this treatments for this can be meeting basic needs to behavioral health therapy. So for meeting basic needs, it could look like providing food to somebody who doesn't feel that they have a source for food anymore. Or it can be water, or if there's a kid that's lost, helping that kid find their parents. And it's also another important aspect is to encourage people to rely on their support systems. So basically, in therapy, a psychologist would, or a case manager would refer this person to make sure that they seek help from like their family or their friends or coworkers and whoever's in their life that's important. So next, there's a discussion on suicide, and it has a huge impact on the American population. So one of the most effective treatments for suicide, and that I've done in my research, is that anonymous sources. So basically, if there was a crisis line, people will be more likely to pursue that because they'll feel like they have anonymity and they won't be able to be tracked, and they can be like, there can be like ambulances sent to them in the case that their suicide is imminent. But that's a good way for people who feel like there's a stigma to get help. So next is clinical and self-care, which can be administered by any psychologists or care managers. So basically, if people take care of themselves, they should be able to kind of limit their severity and symptoms. But if it's after a trauma, as we're discussing, then that may not be enough. But it is an important step for anybody in getting better from trauma, is to be able to take care of themselves. So characteristics of effective mental health professionals, personal skills are empathetic, being a good listener, and remaining calm under pressure. So empathy is important because it helps people feel that you care about them. Being a good listener is important. Active listening is really important in therapy because it shows that you're paying attention and you're able to repeat back what they're saying in your own words so that they feel heard. Last, remaining calm under pressure is important because if you can't remain calm, a person could start to panic and they could feel that you don't really know what you're doing, or they might not trust you. So it's really important just to stay calm, even if you start to feel a little stressed at what they're saying. So professional skills, there should be a technical knowledge of crisis therapeutic methods, willingness and desire to continue to learn new skills, competency with administrative duties, and integrity. So basically, it's really important for mental health professionals to know how to respond in a crisis. There's several clinical treatment methods for reacting in this and treating patients, so it's important to know that. It's important to continue to improve your skills and obtain certifications. Some jobs require specific certifications, so it's important to know that too. Knowing how to document your interactions with patients is also critical, and being a person of integrity is very important because you have to be integritous when dealing with people. It's the right way to do it, and people have to be able to trust you. And if you don't, if you're not trustworthy, people won't. They might not trust you, and they might not trust the organization. So basically, in a crisis, mental health professionals should aid in alleviating patients' suffering. They can do this through teaching coping skills and providing judgment-free listening ears and implementing psychological first aid. So again, mental health professionals should strive to keep disaster victims calm, meeting needs, prioritizing the strength of a community so people come together and do not pull apart. To apply this to my career, I learned about the important role mental health professionals play in the community, both during a crisis and during regular days. Basically, churches have a responsibility to take care of their communities, and the reason I bring this up is because I want to work in ministry when I graduate. I also learned about psychological first aid in the terms of meeting basic needs and recognizing that disasters are traumatic and people should get special treatment after what they go through. So people should be the focus of any career in mental health. So it's important not to lose sight of that. So next, a second slide on applying these concepts. I have learned about effective communication. You need to be professional, but you also need to be compassionate because people have lost a lot. Anyone who's been through trauma will have experienced some form of loss or crisis. So in a disaster scenario, it's important to focus on spiritual health. You don't have to be religious to be spiritual, but spiritual health is an important part of physical and mental wellness. And lastly, working with a trauma diagnosis, a mental health professional should be patient. They should have a strong support system to take care of themselves. They need to be intuitive to their own needs. They need to be aware if they're starting to get stressed out, they're not going to be able to help others in an ideal way. They need to be empathetic but set important boundaries. Thank you for listening to my presentation. I hope you enjoyed it. Please let me know if you have any questions. Thanks. Bye.